social media has become a space where people with mental health difficulties are finding each other in large numbers.
I'm very pleased to say that we're moving forward with social media, so we have a hashtag.
He did the academic stuff, but he constantly stripped all that back, and he challenged people and he said, but what about the person? What about that person?
So important that we take the research, take that partnership with the university, work with the students, work with the academics, and then take that and actually bring it into practice of what we do day in, day out, caring for people within Dorset Healthcare Trust.
Important because the opportunity to do the things you value, to live the life you want to lead, is absolutely central to recovery. Not does clozapine get rid of your symptoms, but does it get you a job? Not does CBT get rid of your symptoms, but does it get you a partner? And bottom line, we all need somewhere to live, someone to love and something to do, don't we?
What's going to happen for them within their treatment intervention, within their recovery journey, within their life?
Well, the other part of what I do a lot of, I think, is about giving people permission to have a go. We need to become, if you like, evangelists really for this way of working amongst all the myriad of other long-term conditions that exist in healthcare. And
it's called now the body-mind approach because in the research the patients said that they started to make links between their mind and their body.
It means that if you actually think you've got a pain in your leg, you're even less likely to be convinced by your GP that that would be a terribly good idea.
They were given an understanding of their symptom, and from that, in relation to their life, they developed ways of coping that was tailor-made to their personal life.
I looked at creating digital language and I thought, well, actually, it's purely a communication. What do you want to say and who do you want to say it to?
Talking about not choosing a ticket on the journey, that's saying that I didn't choose to be born.
So whenever I start looking at working with somebody in that way, I always ask them to draw a diagram.
Because at the moment, in this area, we still have the improving access to psychological therapist service.
But that helps to engage and then just using their clinical, think something that they could change face to face.
And when at lunchtime I asked him, what did he want me to mention before I introduced him? He said, well, over the years, what I've learned is to listen.
The notion that, unlike what I'm doing to you now, the best way of learning is to learn from other people who've made the mistakes first. So learning sets an opportunity, they create an opportunity for a group of you from your area to meet a group of similar people from another area who are all struggling with the same set of problems, establishing principle, and you can talk and learn from one another.
I think sometimes you get scared. Oh God, I don't know what to do. Let's help those communities to accommodate. Don't set up your own group. Look for what's out there and say, how can I support this group? My cousin who's got autistic spectrum disorder and learning disabilities, the Ramblers accommodated beautifully. He spends half his time wandering the hills around Manchester